Hi, I'm Phil.
Hey, I'm Jeremy.
So today we're going to answer a question is, why do my heels hurt in the morning? Mine don't hurt. Jeremy's, well, we can talk about that later. But it's more for you. Do your heels hurt in the morning? So that's a common thing that we see. So Jeremy, how often would you say that you have a patient come in and tell you that their heels are painful when they get out of bed in the morning?
Specifically that, quite a lot, probably like at least 3 times a day.
Yeah,
I'm here. Yeah,
definitely. So amongst our clinics, we'd see 10 cases a day on average, and that's quite a lot. So, Jeremy, what is the number one reason for heel pain when you get out of bed in the morning?
Like the condition.
Yeah, what's the condition that generally causes that the most?
Yeah, so plantar fasciitis.
Cool. So the plantar fascia is a thickening of the fascia, which is sort of, we'll call it a tendon. It's not quite a tendon, but it's like a tendon, and it runs from the heel all the way through down to the toes. And as you can see with this picture here, this is sort of showing inflammation at the insertion of the plantar fascia at the heel. So that's certainly the most common cause of heel pain. So Jeremy, if someone has inflammation in that tendon, why is it so painful when they first get out of bed in the morning?
Yeah, well, if you think about it, I like to use an analogy, like kind of if you don't warm up before you do like physical activity, you're suddenly using that soft tissue there, which is the plantar fascia, but just that sudden use of that plantar fascia, it's kind of, I guess, shocking your body, I guess.
Exactly. If you have heel pain and you're watching this, you'll know exactly what we mean. That when you get up out of bed and you feel older than you are, you're sort of hobbling around, it's pretty miserable. Sometimes it can actually happen just after sitting down for lunch or sitting down for 10 or 15 minutes if you've got a job where you're on your feet a lot. So when you're not actually putting weight on the foot, if you actually have injury to this area, because there's no body weight on it, it'll actually start to swell up in that spot, and those first few steps can be pretty excruciating. So plantar heel pain or plantar fasciitis is a really common condition we see. What would be the first thing you do with someone who has heel pain, Jeremy?
Well, as in treatment, obviously I'll chat to them what they're doing so far.
Yeah.
Some people like, massage it, which helps manage the pain.
Sure.
Stretching it as well. Take a look at, I guess, what goes on their feet.
Yeah.
The amount of activity that they're doing. Other things include, as well as the footwear that I mentioned, supportive things like insoles, like that.
Yeah. So there are a lot of things that when people come to see us, I know I find the same thing. They've seen the physio, they might have seen their doctor, they've been to the chemist to put something in their shoe, they've rolled the ball, rolled the ice under their foot, but they still have heel pain.
Yeah.
So they're the tricky case, and we often see them at that stage where they say, we've tried the normal things. What are the things you like to add to the mix at that stage, Jeremy, that you find really successful at fixing this heel pain, not just getting rid of it, but stopping it from coming back again?
Yeah, so something that would support them the whole time, whether they're at work or whatever they do with their lifestyle.
Yeah.
Usually it's a lot of people walking around a lot, so they're walking around a lot, they've got shoes on, so to support your foot, put something in your shoes, something like, a custom orthotic.
Yeah.
Also exercises and stretches when they can as well. Usually that combination.
For tightness, yeah. And that's something we'll definitely see. One thing I know I say to patients too is if it's caused by the way your foot functions, so particularly if you've got a flat foot, the arch is collapsing, which is stretching on this tendon, it's not going to go away until we correct the way that foot is working. Just like if your eyes aren't working correctly, glasses are going to correct for that so you can see properly. You don't get a headache, you don't strain your eyes. So feet, I say sort of feet are the same. So orthotic therapy, I know, is something that I definitely use a lot too. There's another treatment that I know you and I both like to use for heel pain, which is extracorporeal shockwave. So actually we'll put a link below this video. It's a really high value, high evidence treatment for long-term plantar heel pain. So a lot of the patients that I see, as well as you, Jeremy, they come in and they've had this for, not for a week or a month, but 6 months, 12 months, years even. Yeah. So what happens is you get a chronic thickening of these fibers, and shockwave therapy is fantastic because it's like a little jackhammer that breaks apart that damaged tendon so that it can heal again. Sounds worse than it is. It's not a really excruciating. It's doing it at a cellular level down to the actual the fibers of the fascia. So it's another thing that we can do. I think that's probably enough information for people that have heel pain. But if you are getting out of the bed in the morning, you put your feet on the ground and your heels are killing you, the important message that we want you to know today is that we can fix that. Generally within 4 to 6 weeks, we can have you back to normal again using our proven processes that we use for these conditions. So yeah, tag someone you know with heel pain maybe in this video, or even if you've got it, just either call us or go on our website and you can book online straight away, any time of the day or night. So we'd love to hear from you. Thank you for watching our video today. We'll see you later.
So, yeah.